Well, let's dig a bit deeper now into that news of that historic breakthrough against malaria, one of the world's most deadliest diseases. Dr. Mary Hamel is from the Malaria Vaccine Implementation Programme. Well, thanks for taking time to speak to us here. Just first of all, describe to us, if you can, what sort of kind of impact this is likely to have. How much of a threat is malaria across sub-Saharan Africa?
Yeah, thanks for that question. So malaria remains one of the major killers of children in the world today. I think people don't realize that despite tremendous progress in the last couple of decades, malaria still is a major killer, and especially in sub-Saharan Africa. There's still over 200 million cases of malaria every year. Children get very, very sick with malaria, often end up hospitalized if they make it to the hospital. And there are over 260,000 deaths of children in Africa every year. So it's really a tremendous burden. It ends up with tremendous pain for families, for communities, and really keeps these families and communities in poverty.
Yeah. Well, I have some experience of it myself, having contracted malaria on a couple of occasions. But, you know, so much has been said about the efficacy of this new drug, as well as the treatment, how many times it has to be administered. How is it going to be distributed, and how fair is that going to be, the system?
Yeah, so this is a new vaccine. In fact, it's the world's first vaccine against malaria. It's really a historic moment. It's a huge scientific moment, but it's a tremendous breakthrough as well for child health. So the vaccine is given in 4 doses. There was some concern a few years ago that maybe parents wouldn't bring their children in for 4 doses of a vaccine. And so WHO recommended pilot implementations, and it's been rolling out in these pilots in Ghana, Kenya, Malawi. And what we saw is that there's really high demand for the vaccine. And remember, the last year has been during a global pandemic. And despite that, parents brought their children in. And they came for the doses, and they appreciated being able to have this extra protection for their children, so that when their child has the vaccine, has bed nets, has access to treatment, they have a much better chance of making it through a healthy childhood.
Going forward, how much is this going to cost to distribute it and deliver it across Africa, and who's going to pay for it?
Well, vaccines, we know they often are more expensive than other interventions, but because they have such high reach and can have such high impact, they're some of our most cost-effective public health tools and powerful public health tools. So it's clear that this vaccine will not have impact unless it reaches the children. And this is what WHO and partners are working on next, as the next steps, making sure that the funding is available, that the will is available to assure that children who are at risk get this vaccine.
Dr. Mary Hamel, it's been fascinating hearing your account of how this new vaccine is going to be distributed from the Malaria Vaccine Implementation Programme. Thanks for your time.